Hello, my name is Brandi DeRamus, and for the past few weeks, like you all, whether I'm at work, at school, out shopping, or even at the dinner table, most conversations are about the coronavirus. So, social workers are uniquely positioned to help address the mental health related dimension of health crisis. And social workers also can help parents and guardians communicate with their children about the coronavirus and anxiety they may have regarding the disease and its impacts. There are still uncertainties about this disease, which also fuels anxiety and panic. What I've decided to speak to you all about is the closing of schools and children unable to eat free lunches, even free breakfasts. I'm always keeping up with school systems and all, and for some reason, there is a plan already in action for the upscale communities. If you live in Birmingham, which I am from Birmingham, and you think of Greystone, which Greystone is one of the areas that I want to talk about. Greystone school system have in place right now the time, the dates, and the location on where to for the kids to go and pick up free lunches. Now, if you're familiar with the Greystone area, then you will know for a fact Greystone kids, they don't need free lunches. They have the money to provide lunches for their own kids. However, in the Bessemer city school systems, which if you all compare Greystone to Bessemer, Bessemer doesn't have a plan of action. They haven't posted anything saying where they can pick up free lunches, if there'll even be free lunches provided for the kids. So that's just something to think about. Why is it that the kids who live in these upscale neighborhoods are already have in place free lunch schedules for the kids that really don't need free lunch, or actually don't even get free lunches? But the kids that's living in low income housing or in low income and in poverty, there's nothing structured right now for them. Nothing. So, it's been questionable in my mind. What can we do? How can we do it to help provide them with a nutritious meal every day while being at home? The setback to this is it's kids not being provided a hot meal in which they are used to at least Monday through Friday. And there's a saying when some parents say, they don't like I can't wait for the kids to go back to school. Well, a lot of kids, they really like to go to school because most kids, from what I hear, they rely on meals at school to eat. Anytime schools are closed, whether it is for holidays, summer, or now with the pandemic, the global pandemic, many families struggle to afford additional food and childcare. With coronavirus-related school closures looming, federal lawmakers have proposed a bill that includes help for families that are struggling to feed their kids while at home. The House Democrats have put in place Family First Coronavirus Response Acts. And what that is, it provides families with health coverage, food assistance, and financial support. The provisions in this bill for feeding programs like SNAP will help make sure kids have the opportunity to get the food they need in the event of a sustained disruption to their normal routines. Social workers are concerned about the impact of coronavirus disease to the people they provide services, their families, and others in the community. As a social worker, I'd make sure families have the resources they need during this pandemic crisis. And a lot of times we have to think of preventative measures, such as the CDC recommends the following to avoid spreading coronavirus. Stay at home when you are sick with flu-like illness. Wash your hands frequently with soap and water for 20 seconds and use an alcohol-based hand sanitizer. If you've been to the Walmart, then you know you're out of luck there, because I've gone to 4 Walmarts within the past 3 days. Shelves are completely wiped out, and even toilet tissue. Toilet tissue is not on the shelves. Thank God I'm a couponer, because, I try to keep that stocked on my stockpile. But avoid touching your nose, mouth, and eyes. Cover your coughs and sneezes. Wash your hands and use hand sanitizer after coughing and sneezing or blowing your nose. Keep frequently touched common surfaces clean, such as telephones, computer equipment, etc. Do not use other workers' phones, desks, office, or other work tools and equipment. If necessary, consider cleaning them with disinfectant first. If you are a family member that's in need of any assistance, whether it's financial resources, utility assistance, health care and child care assistance, or even counseling, please report to your local agencies, as those places are there to support you in your time of need. Thank you for watching.